Hey, in this video today, I'm going to cover with you 4 exercises that you need to be doing if you've had an ankle sprain in the past and you're beginning to have chronic ankle pain. If you had an ankle problem for months now and the pain just doesn't go away, that's not normal. There's probably some weakness and mobility problems happening inside your ankle that you can begin to clear up using these 4 exercises today. My name's Dr. David Minoff, and I'm a specialist physical therapist at Paso Manual Physical Therapy. And this channel is dedicated to helping people stay healthy, active, and mobile while avoiding unnecessary surgeries, injections, and pain medications. Please consider subscribing to our channel so that you don't miss out on any of the helpful videos we upload every single week. The first exercise you need to do is toe curls and toe extensions. So many people don't realize that toe muscles, the ones that curl your toes especially, are critically important for the mobility and the stability of your ankle bones. Now, the way that you can do this exercise is just make sure you're seated. You can be barefoot or with socks on, it doesn't matter. You're gonna put your feet out with your heels down, just like so. And once you're in that position there, what you're gonna do with both toes, and just be careful not to do this too hard because you can get cramps. Do this in both feet, with the toes in both feet. Curl your toes down as much as you can comfortably going without cramping, and hold it there for 10 seconds. Make sure that when you're bending your toes down, you're trying to bend every single knuckle in all your toes, even right here, kind of in the meat of your foot. You want to try to bend those as much as you can without pain or cramping. After about 10 seconds, then you're going to come upwards and try to fan your toes apart. You have muscles that bring your toes together and apart, and they help with bringing the toes up and down as well. So you got to use them all. So up for 10 seconds, toes apart. Great, that's about 10 seconds. Then you're gonna go down for 10 seconds, toes together, and you do 10 rounds of this. So down 1 and up 1 is 1 round, and do that 10 times. Yep, so then go up, hold for 10 seconds right there, and after 10 you can come down. Now as she's doing this, I'm just gonna explain why this is important using my skeleton. Now in the ankle here, if you've had an ankle sprain, typically it happens on the outside of the foot. The joint itself doesn't move normally. That's why people have problems. In fact, the bottom part of the ankle bone is called the talus right here. This bone can shift positions forward and backwards and even sideways a bit. It can tilt left and right or in and out. We call that pronation and supination. But there's some muscles that start back here in the calf area behind the lower leg, and they send tendons that run right over the inside of the ankle right here, and they cross that ankle joint and they run into the toes. Flexor hallucis longus and flexor digitorum longus are the ones I'm talking about. And there's another muscle called the posterior tibialis that you'll work as well that attaches to the arc of the foot. These 3 muscles together, when you curl your toes like that, they start to fire and give your ankle joint better mobility and stability. What I mean by those 2 words is that it moves better, that's mobility, and then the joint is positioned better, that's the stability part, so that you can begin to feel better in your ankle. So after you've done this 10 rounds, so 10 times going down and then 10 times going up, next you've got to learn how to use these same muscles with your feet flat on the ground. Now this one's a bit tricky and it's real subtle, so I'm gonna get the camera and move just a bit closer so you can get a better look. All right, so for this exercise, you're gonna have your feet flat just like so, and then if you look at the arch of your own foot, if you look at the arch of our model's foot here, you should see it just subtly go up when you do this. You're gonna be grabbing the ground with your toes, all 5 toes, mainly your outer toes, and holding it for 10 seconds. And you're doing your best here. It's not always easy to do, but you're trying to keep the base of your big toe, specifically right here. You're trying to keep that down and elevate this. Something else that should happen is your ankle should tilt outwards just a bit when you grab your toes like this down here. So when these grab, arch comes up, ankle tips out slightly. Now we're doing this in seated right now so that it's easy to keep your balance, but here in a second, we'll finish off the reps in standing. This exercise is a little tricky. A lot of people skip this one because it's just frustrating to get. It's so subtle of a motion. It doesn't need to be perfect though. If you can grip your toes down without curling them too much, try to flatten these out a bit more. Yeah, that's better. And just, you see how she's blanching in her toe tips like that? That's what we want, is just a little bit of white or lighter skin color at the tips because you're putting pressure through them. Then you're successful. It doesn't need to be perfect. You want to try to keep that base of the big toe down though. That it can become a problem if you're picking it up too much. So try to keep that flat. So now go ahead and stand up. Let me just zoom out a bit. Go ahead and grab again. There you go. That's it. She's grabbing right there. You see the ankles subtly move out. Perfect. And this is practicing using those same toe flexors to get stability in the ankle joints. Excellent work. So do 10-second holds 10 times like this. Really, this is an exercise that you could stand to do all the time whenever you're standing around, say, at the grocery store, if you're in line somewhere, if you're just standing at home or at work. This is something you would do inside your shoes, obviously. You could do barefoot. It is a great thing to activate these muscles on a consistent basis. Now, you're going to get tired doing this, and that's okay. Of course, stop when you get tired, but you don't have to do this non-stop. Okay, let's move on to the next exercise. Go ahead and have a seat. For the next exercise, you're going to do plus signs, X's, and O's. All I'm talking about is making the shape of a plus sign, an X, and an O with your ankle. So take your ankle that hurts, and you're just going to go up and down and throw your toes into it. So when you come up, toes need to extend and open, and when you come down, toes need to come together. And go up and down a few times, literally 2 or 3 times, and you're gonna go left to right to make the plus sign. Yep, there you go, and throw your toes into it. You're trying to get your ankle joint right here to move as much as possible. Avoid moving your whole leg inwards and upwards. It's okay to move some, but you just don't wanna miss moving the ankle joint. After you've done about 5 to 10 plus signs, now do X's. So you're gonna go from out and up to down and in, and then you can go from in and up to down and out. And it doesn't matter that you alternate. You can go all out and up and down and in and do that a few times. And you can go in and up and down and out and do that a few times, or you can crisscross and do both. It doesn't matter. You're just trying to get good ankle mobility and use your toes. I can't emphasize it enough. You've got to use those toes for what I mentioned earlier. You're using these toe flexor muscles to get your ankle joint to move properly with the use of those toe flexor muscles. And then the last motion you want to do about 5 to 10 reps of as well is O's. So you're going to go in circles using the toes. So when you come up to the top of the circle, toes need to fan out and extend or come up. And then when you go inwards, your toes should be going inwards. And when you go down, toes should curl in and go down. Out to the side, toes should go outwards like that. And you're just trying to go all the way clockwise and then all the way counterclockwise. Go both directions a few times. Excellent job. Now, I recommend you do this a few times a day if you've got chronic ankle pain, literally like 3 times a day, sometime in the morning, sometime in the day, and then sometime before you go to bed. But you literally can't get enough of this exercise. If you're hurting more doing any of these exercises, including the next one that I'm going to tell you, there's probably something else going on. It could be like a cartilage problem. You might be developing a bit of arthritis, especially if you're 50 or older. And you might need to go see a doctor, potentially a foot specialist or a manual therapist like myself would probably be the best person, since we understand the mechanics and can offload cartilage and guide you in more specific exercises for your specific problem. But if these exercises help you to feel better, walk better, and have better mobility in your ankle, that might be all that you need to get rid of that final bit of ankle pain that you've had since you had your ankle injury. The last exercise of the 4 that we're doing today are heel raises. We're going to do a seated version and a standing version, but I need you to use your toes again, just like I said. Remember, your toe flexors help to position that ankle bone properly. I do this because I'm simulating the talus is like my fist right here, and then the tibia, this long inner bone, the bigger one, and the fibula at the bottom, they make this shape. They call it the mortise. So it sits in like that. So the joint moves up and down like this, but it has the ability to shift forward and back. And when you fire those toe muscles, then you position it properly so you get full mobility. So for the heel raise, grip with those toes a little bit, not super hard, and then bring both heels up. Slide your feet just under you just a bit more. Yeah, there you go. And it actually will add a bit of resistance if you lean your elbows on your knees like this. If that's too much, you can definitely get off of it. But typically in seated, this feels kind of good to just put a little bit of resistance through your legs. So keep the toes down, bring the heels up, and I'm popping. I have a joint popping every time. That stopped. I scared it away. Toes need to be grabbing the whole time. Yep, just like that. And go up and down nice and easy. And then once you feel like you're ready, we're gonna do some holds. So go ahead and come up and hold it for 10 seconds. As high as you can, gripping the toes gently. You don't have to grip as hard as possible, but you are trying to lift your heels as high as possible. And you should begin to feel the calf muscles work and burn a little bit. After about 10 seconds, come on down. And let's do another 5 reps like that. So at home, I would recommend 10-second holds 10 times. And there's a scientific reason for that. We're trying to get the muscles to fire properly. And if you hold it for about 10 seconds, then you get more of the muscle fibers to work better for you so that you can get a more efficient muscle contraction, increase your strength as fast as possible. Now, for the sake of today's video, we'll have you pause so you can go through all 10 reps, but we're gonna go on to standing next. So let's say you have an injury on the right ankle on this one. When you stand up, lean onto your left a bit more, and you can definitely use something for balance if you need to. You might lean up against a wall, a piece of furniture. I've got a step stool here with a handle on it for our lovely model to hold on to for balance. Stand on this side. So you want to put the balance point away from where you're hurting. So if you have the problem on this side, you'd be holding on with your left side over there. So now this allows you to not bear 100% of the weight through both legs, or 50-50. You can put more like 40-60 or 30-70. Adjust it to the percentage that you can do and use your muscles but not have any increased pain. So let's just say we're going to start conservative at 90-10. So put 90% of your body weight on your left foot and just 10. Now go ahead and grab with the toes and then lift your heels up as much as you can, but with 90% of your body weight on the left and 10% on the right. Hold for 10 seconds. Toes are grabbing just a bit. After about 10 seconds, gently come down. Don't drop yourself down real fast. And if you felt comfortable doing that, then let's try 80-20. So 80% on that side, 20% on this side. Grab with your toes. Go ahead and come on up. Excellent job. Hold for 10 seconds. Staying 80-20. This might be the first time that you're putting this much weight through the legs, so you just have to go through it in this method so that you don't overload it and potentially aggravate it. If you felt good there, then let's go 60-40 or 70-30. You can make the jumps as you feel appropriate. Let's go 60-40 here. There you go. So we're almost at 50-50, and we're going to go beyond 50-50. Good. So let's say that's about 10 seconds. Let's say you're doing great and you can do 50-50 and you want to challenge your ankle. It's hurting less, it just kind of aches from time to time, but it feels good to put weight through it. You feel like this is helping you. Now let's go 60 on this side, 40 on that side. So go ahead and grab with your toes there, leaning more on this side. And if you feel like you need to shift your balance hand to the other side, that's fine. You could. Do you feel like you need to switch?
It's a little more stable when it's with the more weight.
Okay, so this feels good, or do you want to put it on the other side?
Let me move it over here with you.
Sure thing.
Let's switch. So that way you can put more weight here, put the 60 here, and the 40 here.
Great.
There's more stability that way.
Fantastic. So just make sure you're still using your toes here throughout the exercise. So now let's go 70-30. And we're gonna go all the way to as close to 100 as we can, just so you can see where you can take this exercise. So 70% on the right, 30 on the left, still grabbing with the toes. When you grab with your toes appropriately here, you'll feel the meat of the calf muscle, like the thickest part of the calf muscle working, of course, but also a little bit lower below the bulge of the calf muscle. That's where those toe flexor muscles are, and they'll get tired in that region. And then also, of course, in the sole of the foot and the meat of the foot, you got muscles in there that are getting a workout here too. All right, so let's say you're doing fantastic. You've been progressing through this exercise. It's been a few weeks. You're getting stronger, and you're ready to go 90-10 or maybe even 99-1. I would say 99-1 is where I would max this out. So 99-1, 99% of your body weight on this side, and 1% looks this way. You're still gonna hold on for balance, so it's not a true 99-1, but we're just for simplicity's sake, and we're not worrying about a bunch of percentages here. Let's just toe touch on this side. So you're gonna be like this.
Just like that.
Yeah, just toe touch on the left foot. You're still balancing with your right hand.
Okay.
Perfect. You're not really pushing off with this one. You're just toe touching. Then go ahead and grab with the right foot. And come all the way up. Hold it for 10 seconds. Balancing with this leg mainly. And now it's a heck of a workout for you. You're really challenging that ankle. The neat thing about this though is it's not a dynamic movement. You're not changing directions. It's real controlled. You're holding on for balance. So it's a safe way to strengthen your ankle to get that missing strength so you can get the full stability for your chronic ankle pain so that this goes away completely. Chances are you don't need to be in a brace if you've been getting better since your initial injury. If you feel like you don't have any popping or clicking, it's just been like a dull ache or a dull pain that just won't go away. That final 10, 20, maybe 30% of pain that you initially had just doesn't go away. It's likely strength and mobility that you're missing, and this will get you through that last remaining part so you can be 100% pain free and get back to being more active. So once you've done those 4 exercises, now you got to start being more active. You got to get out to walk or jog or do the activities that you were doing before so that you can get back to normal and eradicate your chronic ankle pain. Hey guys, if you like this video, give us a thumbs up and don't forget to subscribe so that you don't miss out on any of the helpful videos we post every single week. We'll catch you in the next video. Bye-bye.